My grandfather passed away from a heart attack when he was only 60, and so this was a real shock for our family. I've really been motivated since then throughout my schooling and university to try to understand why these kinds of things happen to such young people.
When I was in high school, I was very much inspired about research. The actual cardiovascular system fascinates me. The fact that, one organ is able to pump blood to every single part of your body. Being based at the Victorian Heart Institute at the Victorian Heart Hospital is absolutely fantastic.
Being able to test some of our science on samples that actually come from the patients who we want to treat is really critical. And traditionally it's been a real barrier to our research to be able to access these samples. We can culture out some cells and use those in the lab to test all of the different potential medicines.
We have opportunities to better understand the processes that we're interested in the lab in actual patients, and to be able to develop therapies or different diagnostic approaches and be able to take that to the clinic much quicker than we would have been if we were just in a lab.
I'm really interested in how the blood vessels work and how that we can manipulate the blood vessels to improve outcomes for cardiovascular disease. Cardiovascular disease is not just about the heart, it's also about all around the body where these blood vessels feed the organs that they need to. Within these blood vessels, you can get problems occurring. You can get injury, you can get blockages.
The research that I'm undertaking at Monash University focuses on two big aspects: atherosclerosis, where we have the plaque buildup, or in obesity, where we have the buildup of adipose tissue in our body. And inflammation on its own can be protective. However, in these conditions, what we find is that it's persistent at a low grade level.
Being in the university, there are a lot of young students around who want to gain experience in the lab. So we nurture students right from early in their degree. We take students who want to do lab placements. And we also have higher degree students, so masters and PhD students that come and spend longer with us.
I'm very passionate about mentorship, and I think it is essential for the progression and the development of our research and research findings. And so without them coming in and learning and us being able to talk about research and passing on that knowledge, we won't be able to take the next step.
So the really exciting thing about being based at the VHI is the Multidisciplinary Institute, so that we're going to be sitting right next door to engineers, we'll be near IT and physicists, and we'll be right near molecular biologists who understand the full genetic code. All this multidisciplinary approach will bring a whole new perspective to our research that we didn't have before.
We are going to do everything that we can to accelerate discoveries, better understand what's happening with cardiovascular disease. I think it's mind-blowing and I am so excited.